Welcome back. Today we will continue with part 2 of this short health video series, where we will discuss some specific nutritional strategies for supporting immune function against infection. We first have omega-3 fatty acids. Fatty acids in general, of course, are one of the body's major macronutrients that provide energy, but they have a variety of other functions, such as in cell membrane structure and cell signaling. The omega-3 in the name refers to the position of the double bond in the fatty acid structure. Omega-3s play an important role in the function of both innate and adaptive immune cells. For instance, the omega-3 fatty acids DHA and EPA serve to help regulate the phagocytic activity of macrophage cells. They also tend to increase both the number and phagocytic capacity of neutrophils. In other words, they're able to engulf and destroy significantly more pathogens with adequate amounts of omega-3 fatty acids present. Another major role that omega-3 fatty acids play in the body is in the regulation of our body's inflammatory response. Short-term cell stress responses are designed to mobilize immune defense cells, as well as to stimulate the growth of new tissue to repair and restore damaged structures after an injury, infection, or other illness. Once completed, this short-term inflammatory response is meant to cease, usually with the help of cell signals from omega-3 fatty acids that help to return the body to normal after an injury or infection has ended. However, sometimes an inflammatory response can become chronic and inappropriately long-term. This can either be due to insufficient omega-3s or excessive omega-6 fatty acids. Omega-6s produce cell signals that tend to promote the cell stress response, while omega-3s tend to lower it. If there is an abundance of omega-3 fatty acids in the cell membranes, signals that lower inflammation will be more common. But if there is an overabundance of omega-6 fatty acids, cell signals that promote inflammation will be more common. Both kinds of fatty acids, of course, are needed for the full regulation of the inflammatory response, but chronically promoted inflammatory responses can unduly damage cells and tissues, and it contributes to a variety of chronic health problems over time. Unfortunately, omega-6 fatty acids are quite prevalent in commonly consumed foods, such as processed snacks, vegetable oils, and factory-farmed red meat. Most people tend to have a higher amount of omega-6 fatty acids, putting them at increased risk of chronic inflammatory conditions. This is why it is advisable to most people to try and increase foods in the diet rich in omega-3s, or to supplement with them, so as to support a healthy and balanced inflammatory and immune response. Vitamin D is most well known for its role in promoting calcium absorption and supporting bone health. But in recent years, it has been receiving a lot more research attention for its role in both innate and adaptive immune function. It turns out that a wide range of tissue and cell types feature vitamin D receptors that modulate activity relating to immune function. Recent studies seem to show that calcitriol, the active form of vitamin D produced in the kidneys, promotes the antimicrobial activity of macrophages and monocytes. Not only that, but vitamin D is also important to the function of antigen-presenting cells, such as macrophages and dendritic cells. These are the kinds of cells that present novel antigens to B and T cells for targeted responses. This means that vitamin D is also important for crosstalk between the innate and adaptive branches of the immune system. There is a growing body of intervention studies that show vitamin D has protective benefits against infection. For instance, in a placebo-controlled trial of 95 tuberculosis patients, the inflammatory responses to infection resolved much more quickly in those subjects who had received high doses of vitamin D as an adjunctive treatment. At this point, the current evidence seems to show that vitamin D is a relatively safe nutrient that offers significant promise for disease prevention and even as an adjunctive therapy. While deficiency of vitamin D appears linked to immune dysregulation, it is unfortunately a fairly common problem, affecting an estimated 42% of American adults. This deficiency can be attributed to low nutritional intake, the time of year, the use of sunscreen, not enough sunlight exposure, or darker skin pigmentation. Therefore, consuming foods that are rich in vitamin D, or even vitamin D supplementation, is advisable, especially during flu season in the winter months. The foods that are rich in vitamin D are few, but they include fatty ocean-going fish like mackerel, salmon, sardines, as well as cod liver oil, as well as some types of mushrooms, such as shiitake mushrooms. Probiotic bacteria promote immune health by competing with pathogens for nutrients that they would otherwise use to proliferate and infect the body. Probiotics also produce substances that kill infectious bacteria or stop their growth. They also compete with them for space to adhere to the intestinal wall. If pathogenic bacteria can't get a foothold due to the place already being crowded with healthy residential bacteria, they can't proceed to infect. These healthy probiotic bacteria have also been shown to directly support the epithelial barrier of the intestines. Another important way that these healthy probiotic bacteria promote immunity is by promoting healthy immune cell activity. Probiotic supplementation has been shown to induce increased activity of natural killer cells in the spleen as it shifts the composition of gut microflora towards more beneficial bacteria. Antioxidants are not a single substance, but rather a broad category of molecules that neutralize free radicals. Free radicals being molecules that cause oxidative damage to cells and tissues. All major classes of biomolecules are vulnerable to free radical damage. Free radicals are generated continuously as a result of cellular metabolic activity, such as from breathing and using oxygen to derive energy from our food, as well as an immune system strategy for destroying infectious agents. Reactive oxygen species, or ROS, are one kind of free radical and can include superoxide anion, hydroxyl radicals, and hydrogen peroxide, as well as reactive nitrogen species such as nitric oxide and peroxynitrate. During an inflammatory process, the action of phagocytes and bacteria can result in increased amounts of superoxide anion radicals. Neutrophils and macrophages are known to produce superoxide radicals and peroxides, which are essential in the fight against invading microbes, but can lead to collateral damage of surrounding tissues. Antioxidants are essential in these circumstances to regulate the processes that create these free radicals. Balance between free radical formation and elimination is crucial for maintaining homeostasis. Nevertheless, oxidative stress may occur when this balance is disrupted by excessive generation of free radicals. This can be due to inflammation or to certain bad habits, such as sedentary lifestyle, smoking, alcohol, as well as eating foods that are highly processed, fried, or contain a lot of sugar. Different antioxidants such as beta-carotene, vitamin E, and vitamin C improve different immune functions and serve a protective role against damage caused by bacteria, viruses, or parasites. The most important antioxidant in cell membranes is alpha-tocopherol, the main member of the vitamin E family. Vitamin E has very efficient antioxidant activity. This vitamin is essential for the maintenance of an appropriate immune response to infection, especially in inflammatory cells. Vitamin E reduces damage to lipid membranes due to the formation of ROS during infections. Therefore, vitamin E exerts an important role in maintaining the cell membrane integrity and in preventing lipid peroxidation by scavenging free radicals. It tends to increase lymphocyte proliferation, natural killer cell activity, and phagocytic functions of macrophages in the alveoli of the lungs. Vitamin C also plays an important role in the protection against oxidative damage, particularly in white blood cells. Biological effects of vitamin C appear to affect most aspects of immune functions, because concentrations of this vitamin in the plasma and white blood cells rapidly decline during infections. For this reason, it is surmised that ascorbic acid, or vitamin C, reduces the incidence of colds. However, this has not been clearly demonstrated. Early studies have reported that the moderate intake of ascorbic acid seems to reduce the duration and severity of common cold symptoms. Vitamin C was also found to improve certain components of the immune system, such as antimicrobial natural killer cell activities, monocyte adhesion molecules, and lymphocyte proliferation. Finally, melatonin is a hormone that is made in the pineal gland near the back of the brain. Its primary function is to promote restful sleep at night by communicating to the body when it is dark. However, melatonin is also yet another powerful antioxidant that helps regulate the function of innate immune cells. In various studies, it has been shown that injections of melatonin can stimulate increased numbers of macrophages, and supplementation of melatonin tended to increase the abundance of natural killer cells in bone marrow. Because of melatonin's primary function of promoting sleep, this would seem to underscore the value of sleep itself in the support of the innate immune response. Therefore, getting the necessary 7 to 9 hours of sleep per night is one of the best ways to support your immune system naturally. Insufficient sleep will leave you more vulnerable to getting sick after exposure to a virus. Studies have shown that adults who received less than 6 hours of sleep per night were more likely to develop a common cold after exposure to a virus, when compared with adults who had been getting 7+ hours per night. Additionally, women who slept less than 5 hours per night were more susceptible to contracting pneumonia. Sleep is also associated with release of cytokines. Cytokines are cell signals that help to recruit and coordinate immune cells to a site of infection or injury. With sleep deprivation, a reduced level of circulating cytokines can mean decreased activity of innate immune cells, as well as reduced T cell and antibody function. Well, that's all we're covering for today. I hope you found this video useful and informative. Please consider liking and subscribing if you enjoyed this video, and leave any feedback in the comments section below. Be back soon with a new health video.